Mr. Reichert's recognized for 5 minutes.
Thank you, Mr. Chairman. Well, welcome, Madam Secretary. Thank you for being here today. I think that all of us on this panel agree with you on a number of things that you have testified to today, and some of those I'd like to quickly repeat. Quality versus quantity. I think we can all agree that that's a goal. Efficient service, cost-effective service, accessible service, all of those things I think all of us who are trying to resolve this issue would agree that would be a great thing to accomplish, but we know it's going to take a while. I want to focus on the cost increase, and the Chairman touched on this question, as did some others, and a promise that was made by the President. This was a promise that everyone could keep their health insurance if they liked it. If you like your health insurance, you can keep it. I think Mr. Teaberry mentioned that earlier. You and I had a conversation, I think, the last time you appeared here regarding this issue. But since that time, your own organization has said, so in your agency, regulation on grandfathered health plans stated that 7 out of 10 employers will not be able to maintain their grandfathered status. According to a survey completed last fall by Towers Watson, 1 out of every 10 mid-sized or big employers expect to stop offering health care coverage to workers after insurance exchanges begin in 2014. So that seems to run contrary, at least from my perspective, to the President's promise. And also connected with this issue is the 11.4 million Americans who have their own health savings accounts, who have great concerns as to whether or not they will be able to keep their health care plans because of the restrictions of the law placed upon health savings accounts. Can you commit today that the 11.4 million Americans with HSAs will be able to keep their plans in 2014 and beyond?
Congressman, as you know, that as part of the implementation strategy, we are looking at what will constitute health insurance, and some of those plans are very much companions to a health insurance plan and would very much be applicable on into the future. Others are not insurance plans. They're really kind of savings plans for portions of health care costs that are not covered by insurance, but they don't accompany a health care plan. So it's impossible to say across the board what will happen, as the part of the goal of the Affordable Care Act, as you know, is to have a health insurance plan which has a comprehensive set of benefits, but also has affordable characteristics. And your notion that somehow companies in grandfathered plans will not be able to keep their grandfathered plan is really not accurate. What that reflects is employers changing the plan on a voluntary basis in a marketplace where they are looking to new or innovative strategies or other operations, and so they have made the choice to change the insurance plan outside the grandfather rule. It's nothing that the Affordable Care Act is imposing on them. It's the employer or issuer's choice.
They make that decision based upon the language in the law, though?
No, sir. The language in the law basically defined what you have in 2010, and it put some framework around that snapshot. And if an employer in a voluntary market chooses to change that plan, he or she is well within their capability of doing that, and they're doing that all the time. And that's what the projection is.
If I may, Madam Secretary, the bottom line is if you like your health care plan, you're not going to be able to keep it. It's going to change. The last question I have is that thanks to Children's Hospital Graduate Medical Education Program, children's hospitals have not only expanded their residency programs, they've also increased their training experience and services in underserved communities, expanding children's access to care. Hospitals like Children's train over 5,600 full-time equivalent residents annually. The administration has proposed cutting this funding by 2/3. Have you looked into the impact of this cut on children's access to health care and how it will look in the future?
I have, Congressman, and I've actually visited with a lot of the leaders at children's hospitals across the country. There's no question that in a better budget time, I think a robust funding of all graduate medical education would be the preferred path forward. What this budget reflects is a redirection of some of those dollars to research universities and others who are focused primarily on additional primary care providers, and there are other sources of funding outside of the children's graduate medical education that funnel into children's hospitals. So we are watching very closely the good work they do and the access to care, and we'll continue to monitor that as we move forward.
Thank you, Mr. Chairman.
Thank you. Mr. Neal's recognized.